A functional health sector in any society plays a very critical role in the growth and development of the economy of such society. In other words, ensuring healthy lives and promoting well-being for all ages is important to building prosperous societies. To achieve such requires a strong commitment from government, as the benefits outweigh the cost. While at least half the global population does not have access to essential health services, many of those who do suffer undue financial hardship, potentially pushing them into extreme bankruptcy and poverty. Concerted efforts are therefore required to achieve universal health coverage and sustainable financing for healthcare delivery. 59 years after independence, Nigeria is still struggling with the provision of basic health services for over 180 million people. The healthcare sector is still a labor-intensive handicraft industry. In spite of advances in technology and healthcare provision, the situation is still bleak. There is a growing evidence that the most equitable and sustainable way of achieving better health outcomes is through the universal coverage.
Smart Delta.
The Nigerian 7th Senate in February 2014 passed the National Health Bill. The bill, which was the brainchild of Senator Ifeanyi Okowa, was designed to revolutionize the health sector in Nigeria.
Coming from the background that I had in the Senate and the challenges that we did see, where no state was actually participating in the health insurance scheme at the national level, I thought that the first thing I could do for our people was to start a contributory health scheme. And the state actually is paying the premium for all children under 5 and our pregnant women. We begin to have some success stories, and we hope that we're able to advance it.
We need to appreciate you for making sure that our under 5 and pregnant women are being treated free. And it's not just on paper. In the remote areas, at the areas that are in the creeks, you have made enough plan for all of them.
Governor Okowa has been a partner in the health sector for so many years. He was Senate Chairman on Health. He worked closely with the Federal Ministry of Health. So working with him to improve health outcomes in Delta is virtually just something you can say will happen. So it's no surprise the achievements he's been making.
Just as he vigorously pursued the passage of the National Health Bill into law, Governor Ifeanyi Okowa, on assumption of office as governor of Delta State, paid priority attention to achieving universal health coverage and made it a necessary pathway to end poverty, boost shared prosperity, and ensure access to quality and affordable healthcare services for all residents of the state through the Delta State's Contributory Health Scheme.
The Contributory Health Scheme is fundamental in it all. It has saved people the problem of out-of-pocket expenditure. Someone is ill, goes to the hospital, and at that point in time may not have money. But for persons that are properly registered, enrolled, they don't need to have money in their pockets because the premium which they pay covers them.
Dr. Ifeanyi Okowa, the executive governor of Delta State, has done very well in our reckoning, especially in the health sector. And we're particularly delighted because of the interventions relating to universal health coverage, which will deal more with our people at the rural level, malaria and the care of the under 5 and pregnant women.
Governor Okowa, through the services of the Health Commission, has replaced the unease and uncertainty associated with access to health care with hope, optimism, and prosperity. To this end, there has been infrastructural development of state hospitals and primary health centers, procurement of drugs, and cutting-edge medical equipment in major healthcare facilities across the 3 senatorial districts.
For universal health coverage to be realized, primary healthcare delivery is key. And that is why the state government is paying particular attention towards revamping and strengthening of the primary healthcare centers across the state. So a lot has been done there.
Everything we need to resuscitate a patient in emergency cases are all here. In fact, I appreciate the effort of the governor of this state by providing all these kind of ultra-modern medical equipment in this place. The services we render here is more than primary healthcare.
The Commission has made tremendous progress in the registration and enrollment of Deltans into the scheme. The financing for free maternal and free under 5 healthcare program was taken over by the Delta State's Contributory Health Commission. So far, hundreds of thousands of pregnant women and children under 5 years are covered under the Equity Plan, which caters for the vulnerable group. This will include the elderly aged 65 and above, physically challenged, etc.
We will ensure that every corner of the state is covered. Where they don't have facilities, we need to get more facilities for them and ensure that it is universal. Universal means it is cover everybody in the community, in society, in the state, and also provide quality care for them as well as protect them against high financial expenditure.
Registered enrollees in the scheme are provided with identity cards to enable them access a defined healthcare benefit package from accredited healthcare facilities. The formal sector and equity plan have been institutionalized to aid effective and efficient operation of the scheme.
When the contributory healthcare initially came, people thought it was something that was not going to be beneficial to everybody. But right now, everyone now sees the importance of it and how far the government has really gone. We want to appreciate our state government for what he has done, and we pray other states will emulate our state.
Seriously, Delta State, they are blessed. They are really enjoying free medical care, free maternal care, free sensitization. Everything here is free.
The desire to broaden the reach of the program and further stem the burden associated with out-of-pocket payments for Medicare on families, especially the informal sector, would constitute over 60% of the population. The Okowa-led administration approved an annual premium of 7,000 naira per individual. With this very highly subsidized premium, enrollees in the informal sector can enjoy quality health care that is affordable and easily accessed. Family registrations are further given at discounted rates.
Since the commencement of this program, patients have easy access to health care. They don't have to pay from their pocket again. We've improved on the service also here. There's a dedicated clinic for those under the program, those in the informal and formal sector, and we try to reduce the waiting time also. Doctor there's other non-medical staffs that attend to them. It has made our services even better.
The Commission has deployed an ICT platform in partnership with InterSwitch and eClad Health, utilizing modern apps and equipment to assist personnel in accredited health facilities in their service delivery. Registration can be done on-site and online. The Commission is working assiduously to improve on the scheme and ensure its sustainability. In order to speed up the reach, the Commission has begun the process of upscaling accredited health facilities from 110 health centers to 300 in the next phase.
We have a mandate to ensure that all residents of Delta State, irrespective of their socio-economic status, irrespective of their geographical location, have access to quality and affordable healthcare services whenever they need it. And with that, we have to ensure that the facilities are available and accessible to all communities and all residents, and that the facilities are functional.
So far, a total of 267 primary health centers have been upgraded. 23 are under the Access to Finance program, 66 government clinics, 1 federal facility, 7 mission hospitals, 59 private hospitals, and 5 clinics outside the state. It is supported by Farm Access Foundation and Bank of Industry. The goal is to ensure that such private facilities can run the center as a world standard clinic.
It is a public and private partnership in which the government has given us the facility to run as a private enterprise. They have given us access to relatively cheap finance from the Bank of Industry for renovation and for initial startup working capital. And the Delta State government has a contributory health scheme, provide healthcare to all residents of the state. And so we will provide healthcare to those residents of the state through the health center.
Smart Delta.
You better run, come to Delta State. Come and see the good things where Okowa they do. You better run, come to Delta State. Come and see the good things where Okowa they do. I see your job and work creation in Delta. Make the youth say them highlight Okowa. I see good roads everywhere in Delta. Make the people say them cola. Empowerment for the farmers in Delta. Good and quality education in Delta. Well-equipped hospitals here in Delta. Peace and security, no level.
The Delta State's Contributory Health Commission DSCHC has additional mandates to run cottage hospitals in hard-to-reach rural and riverine areas and enroll residents of such communities in health insurance. The Smart Delta media team took an on-the-side visit to some of the health facilities in order to bring you the real stories of the beneficiaries of the scheme. Bomodi local government area got our attention as a riverine area. The task of connecting the communities was made more challenging with the surge in the volume of floodwater flowing into the river and damaged parts of the bridge connecting Bomodi, Akugbene and other small communities surrounded by the river. Upon arrival at the village, after a long bumpy drive, the only means of getting to the health center was a canoe, and because we were taken through the wrong route, we had to trek through the forest, swamp and flood, and finally arrived at the center. We were welcomed by Dr. Daffy Stephen, the medical director, and his team, who took us around the facility, telling us the story behind the health center.
This is one of the smart agenda of Dr. Ifeanyi Okowa. The essence is to bring healthcare to the barest minimum, to ensure that everybody in the rural environment gets healthcare to the doorstep. Because that was one of the reasons why the vision of the contributory health scheme. So we come in here, we're happy because the contributory scheme is here to stay and is sustainable. It's the best thing that can ever happen to health system in Nigeria.
This facility is managed in partnership with MedBroy Medical Services. Dr. Daffy commended the warm reception and cordial relationship that exists between the health workers and the community members in 1 month of its operation. Some beneficiaries expressed their satisfaction with the services.
The small money where my husband they bring, they pay hospital bill, they use and they feed the hospital bill, they pay thank Okowa for this free treatment for our children.
The first time we this clinic not there, we suffer a lot. Any people were sick, we blood not there. And per Monday, sometimes we go carry boat reach half, don't die. This year now, government don't bring this center here, so it help us very well.
Wilfred, Deborah, and some members of the community share their experiences about their work.
I want to say thank you to Governor Ifeanyi Okowa for bringing health services closer to my people, because I have that joy working here.
This clinic is every day, or with midnight when we come. The doctor when they here, they help us, and the doctor then they take money, and everything is free.
As stories of quality and effective healthcare delivery and testimonies of good life continue to resonate, the Okowa-led administration has continued to replicate same in more hard-to-reach rural and urban communities.
The governor is doing fantastically well, particularly in ensuring that they take care to the grassroots, free health services, and the implementation of primary health care activities and the insurance activities in Delta State.
There are more facilities here, and there is a doctor, there are nurses, and they've been so nice and caring. In fact, the equipment here is wonderful. I least expected it to be in a rural area like this,
The governor have done so well because he's a medical doctor, so and he has the interests of his people at his heart. That is why he's setting up this kind of facility in a rural area so that the citizens of the state can get the best medical care.
Living in the rural or the riverine area is not a disadvantage, neither is it a death sentence. The governor of Delta State has ensured that he's committed to improving the lives of those who live in this area through the provision of quality, accessible and affordable health care. Join me as we take you on a ride to show you some of the things and the giant strides that has been provided to Deltans who live in this area.
Ode Shekiri is the ancestral home of the Olu of Warri and the Shekiris. It is a riverine community that now enjoys up-to-date amenities due to the impact of Governor Kowa's smart initiatives. The serenity of the island, its tranquility and good network of roads laced with streetlights speaks of the ambience of the kind of life provided for the people. However, the lack of a proper health facility was a challenge. With the handing over of healthcare facility built by Desopadek and the revamping of a health center by the Delta State Contributory Health Commission brought a vista of hope to residents of the community who for decades have craved for basic health care.
The construction of the primary health care center located at Ode Shekiri, Warri local government is being handed over to Delta State Contributory Health Commission for the use and the benefit of our brothers and sisters that are living in Ode Shekiri. In the name of the Father, the Son, and the Holy Spirit. Amen.
This is a riverine community. If you look who needs healthcare center, it's we for this community. We appreciate it more. So when you see this community, you can see the good work of the smart governor. It touch everywhere.
Kowa don't try. All we you make sure Kowa they try for we. You know the tribalism. When it you do for inside, they see they do for outside. Even the health center now, them born for this town. The big one like this now never day once. So this one will they benefit and it go do more.
All pregnant women, children under 5 years and senior citizens above 65 years of age in Ode Shekiri are now enjoying automatic health insurance. We met Mrs. Didi Favor, a mother of 4 who had health crisis a day before our visit. She narrates her story.
I want to appreciate the governor for what he has done for us because assuming there was no health center in this place, we'd have wasting our money to rush down to Warri to look for a. But this time, they have given us a center. We don't stress ourselves again. Everything is free.
Antenatal time with the women was also an interesting moment for them, as they are taught vital tips to help their gestation period.
Which type of food do we eat to have good health? Yes, it's all about 6 classes of what? Food. And these classes of food contains all the nutrients that we need in our body so that we get what? Healthy. Like what? Carbohydrates, protein, vitamin, mineral salt, oil, water. Do you understand it now?
Beneficiaries of the program spoke glowingly about the insurance scheme in Ode Shekiri and how they are driving the process.
At my house, my friend called me, see what they happen.
I had no idea this healthcare existed, but a friend enlightened me that I should register my kids and that from 0 to 5 years they will enjoy free healthcare. I have taken advantage of it and registered my kids, and I'm grateful to the government.
So I thank the governor for what he do for us.
I'm opportune to see this free medical program. It also renders help to me because it makes me save income. The money I'm supposed to use spending for kids when they are ill, I do save it for other purposes. So it's a privilege. I really appreciate.
Another facility that has made huge impact in the scheme is Capitol Hill Clinic, situated in Ogume, in Indokwa West local government area, a rural community in the upland. Less than 8 weeks from the date of commencement, the facility has enrolled over 500 persons. The facility provides complete basic primary health care services.
I was about to go to Asaba for the checkup when my friend told me if I've heard of the hospital in Bagos. So I was surprised. She said I should come with her. So I simply followed her. And when I got here, they attended to me so quickly and gave me drugs. And the drugs were free. Governor Kowa, through this, we know that he cares for us.
Ever since the operation has been opening, people from the community are really appreciating the groundwork of Okowa. That Okowa did a marvelous good to the community. The whole community at large embracing it. They are overwhelmed how Okowa remember them how to build the kind of the infrastructure, new or modern health comprehensive center to the community.
Some of the health workers go extra miles in providing care to ensure they win the trust and confidence of the people to take advantage of the scheme and not patronize quacks.
You see the card that I gave to you now, everything is here. Anytime that your children is not feeling fine, we are free to bring them here. We are not collecting any money. Delta State government is taking very good care of it.
I want to use this medium to thank our amiable governor, Dr. Actor Okowa, for bringing healthcare to the grassroots, to these out-of-reach areas. Now we can conduct deliveries in the rural areas, no maternal and child deaths, infant mortality reduced to the barest minimum.
The rate of malaria is really high. Just imagine if this facility is not here. Only God will know what would have happened. I want to thank our governor for providing this health facility for this community. He should not relent. God will bless him.
Amai Primary Health Center has Paylon Memorial Clinic as its health provider. The facility is well equipped to provide care at the primary level of care. There is also a standby ambulance to aid easy movement of patients with health challenges. To ensure the effective running and sustainability of the scheme, the facilitators established an advisory board saddled with the task of assessing the scheme at intervals while looking ahead for prospects.
We were already excited and happy for the hospital because this is the first major thing, that is development we have had. So what we will do is to make sure that this hospital is sustained. It's a treasure to us. The governor has done so well for us.
Governor Kowa is a very wonderful man, and him bringing this health center here, the man is going far away, because God will use this health center to save Amai, Araba, Ezionum, Obiaruku, and so many places.
In this hospital, since 1 month I started, I've gotten at least 338 enrollees. Since then, we are trying to make a progress, and we went to churches to make an announcement, then go to communities with tank criers.
I'm very, very surprised to see this kind of equipment here in the rural area. It surprised me, so I'm happy about the Okowa.
Smart Delta.
We also took a trip to Sapele in Delta Central Senatorial District. Sapele Central Hospital is one major health facility in the environment. The scope of Medicare in this facility is regularly being expanded to meet with the health needs of the people as it brings qualitative health care, affordable and accessible health care to their doorsteps.
At the commencement, there were a few enrollees, less than 10. But by January 2018, the number had risen up to 1,000. The number of enrollees we have now is those in the formal sector are 2,500, while from the informal sector we have 164. I want to say this is one of the most impactful policies of government.
At a point when I realized that my baby was in the breech presentation, knowing fully well that I was going to end in CS. When I made inquiries, and I was very surprised when my matron told me that it's free. As you can see, even to blood transfusion, everything is free. I say a very big thank you to Dr. Ifeanyi Okowa.
I want to thank the state government for what they did by providing free maternal and child health, for free theater, everything. My brother's wife did. All the money has been paid by the state governor.
Testimonials from beneficiaries affirm that the mandatory health insurance scheme is a welcome program.
Myself, my wife, and 4 children, we are benefiting from the health contribution scheme. Give them treatment. We don't pay for the drug. I have to commend the government that what it's doing is very right, and it should continue.
They are trying for us right from when the baby was in my womb. I registered here with them. They are really good. Even the nurses, the doctors, they tried for us. Everything here they give to us is free.
Delta State government is fully committed to the overall welfare of all Deltans. The next 4 years of this government will be a guarantee for greater development of the riverine and rural communities, with several ongoing projects and those in the pipeline for execution.
Okowa dey work, we dey see am, we dey enjoy am.
Come to Delta State, come and see the good things where Okowa they do. You better run, come to Delta State, come and see the good things where Okowa they do. I see your job and work creation in Delta, make the youth say them higher. Okowa, I see good roads everywhere in Delta, make the people say them cola. Come live in Delta, say me I say, come invest in Delta. Come explore the potentials of our state.